Hi, I'm Dr. Harry Oken for Columbia Matters. This month we're going to be talking about shingles. Shingles is also, the medical name for this is called herpes zoster, sometimes just called zoster. This is a viral infection that occurs in many people after they've already had chickenpox remotely. After you get chickenpox, the chickenpox virus becomes dormant and lives in the cell bodies of the central nervous system. And for reasons we don't 100% understand, it can become active. Typically, the older you are, the higher the incidence. In fact, about 10 out of 1,000 people after the age of 65 will develop shingles. Now, the shingles eruption starts with what looks to be almost pimples. Sometimes the pimples actually hurt. Even before the eruption occurs, some people will have a funny pain, may not feel well, may have a low-grade fever. Then the eruption occurs, and the eruption looks like small grouped pimples. The pimples then coalesce and sometimes become fluid-filled. We call those vesicles. Now, it always occurs on just one side of the body. That's the way we determine that this is actually shingles, by its appearance. Once the eruption occurs, we like to treat it as soon as possible. So if you have an unusual rash, please see your doctor. The doctor can quickly, by its appearance, understand whether or not it's shingles. Now, once shingles is diagnosed, if we get to it within 72 hours, preferably between 48 and 72 hours, we'll probably start an antiviral compound. The antiviral compound actually decreases the time that you'll have the shingles and also decreases the likelihood that you'll have after shingles pain. We call the after shingles pain post-herpetic neuralgia. Now, this can be a very, very painful process that occurs even after the rash is gone. The rash actually evolves, so it starts as pimples that are grouped, they coalesce, they become sometimes fluid-filled, and then they crust. All along this time, you may have exceptional pain. And this pain can be controlled by Tylenol, acetaminophen, Advil, ibuprofen. Sometimes it requires even stronger drugs. And we have those drugs available should that occur. The antiviral that we're talking about, acyclovir, or valcyclovir, is started within 48 to 72 hours of the eruption. Now, starting it early decreases the likelihood of having after shingles pain, post-herpetic neuralgia. So, if you have an unusual looking rash, typically on one side of your body that's painful or burning or itchy, see your doctor. Importantly, if you've never had shingles but you've had chickenpox, please consider taking the shingles vaccination. This is a live vaccination that's given once in your lifetime, usually in the arm, and this live vaccination tells the immune system to be more active. It boosts your immunity to shingles, that is herpes zoster, and therefore decreases your likelihood of getting the shingles, but it doesn't guarantee it. However, if you've had the vaccine and you've taken and you do get shingles, you may actually have a less of a case of shingles and are less likely to get post-herpetic neuralgia or after shingles pain. And if you haven't had shingles, but you're over 50, consider getting the shingles vaccination. This has been Health with Dr. Harry Oken. I'll see you next month.